Good morning. I'm Dr. Madhav Prabhu. I'm speaking from KLE Hospital for Venudhwani. I'm here to speak about human metapneumovirus, that is HMPV. As we all know, there have been a lot of news in the social media about this virus. But I have come here to reassure you that there is not going to be a major problem with this virus. 90% of us, Indians, have already been exposed to this virus. This virus is not new to us. It was first discovered in 2001 in Netherlands, but almost all populations have been exposed to this. Especially in this winter season, that's October to January, you will see a rising number of cases of HMPV in our population. This is not new. Every time in winter, when you were children, when I was a child, and you have seen in your children also, there are diseases which come with low upper respiratory tract infections. There is rhinorrhea, there is cough, fever, and these are the only symptoms that are found in this virus. Usually they do not cause any serious symptoms. So fever, cough, somewhat, these are the very most commonly found symptoms in these patients. It does not cause any major disease except in patients who are having an immunocompromised state like diabetes or HIV, or COPD patients who have wheezing and all that, or asthma patients. Now, if your patient has this upper respiratory tract infection, he has cough, fever, and suddenly starts developing wheeze, that's a musical sound like soy in the chest, that is the time you need to be alert. You need to take extra help. Otherwise, for these fever and upper respiratory tract infections, you can just go to your doctor. They will prescribe you some medicines. There is no specific medicine for this disease. They will give you something for fever, and they will ask you to maintain hydration so that you drink a lot of fluids, juices and all that. Need to take a lot of rest and keep yourself warm. These are the only things that you need to do if you are infected with this virus. This virus does not present with any symptoms which are unique. All these viruses, including respiratory syncytial virus, influenza, parainfluenza, adenovirus, rhinovirus, and our virus in question, they come with the same symptoms, and the treatment is going to be almost same because there is no treatment for all of this. You just have to take rest, eat well, keep yourself warm. If you are having infection or if your child is having infection, please keep them at home. Let them take rest. Otherwise, they'll spread the infection in their school and to the teachers and to the parents. Keep them clean. All the surfaces that are exposed to contact clean so that there is no spread from these inanimate fomites. Also, if somebody is sneezing, if somebody is coughing, keep a little distance from these patients. And in crowded places, like if you go for a fair, if you go for any other meeting where there are a lot of people, there I think you should continue wearing a mask. Apart from this, no other special precautions are required. This is not a deadly virus. We have already been exposed to this virus, and you will not have any problems with this virus. There will not be a lockdown or shutdown with this virus. Please keep that in mind. Don't get carried away with what social media is carrying. There are trusted websites like World Health Organization and CDC which will give you accurate information. Please rely on these websites for information and do not get swayed by any other scary social media post. We assure you that there is going to be no problem. Just take your doctor's help in time. Thank you.
KLE ಕನಸು ನನ್ನ ಸದಾ ವೇಣುಧ್ವನಿ.